Depression is very common among my patients with chronic pain. And chronic pain is very common among people with depression. It is hard to know what comes first, the depression or the chronic pain. The most important is to identify that the person is depressed and start treatment as soon as possible. There are various available effective strategies to treat depression. And to remember, we'll talk about the 5 P's: plate, pillow, physical, pills, and psychology. So, I will explain today the 5 strategies to treat depression. There are various available effective strategies to treat depression. I always tell my patients that we have groups of strategies. We have 5 groups, and it's good to combine them to treat depression. The sooner the patient is diagnosed and start treatment, the better. The 5 P's represent the 5 strategies, and it's easier to remember. The first P is your plate. Is what you eat influences your mood. The second P is for your pillow. How you sleep influences your mood. The third P is for physical exercise. The fourth is for pills, in this case antidepressant medications. And the fifth is for psychology. Those are the mind-body therapies. Your plate. Have you heard this? We are what we eat. Well, that's also true for we think what we eat. If we feed our body with junk food, our mind will have to find nutrients in the junkyard. So briefly, I'll give you 3 reasons why you need to improve your nutrition to treat your depression. The first reason: our brain needs fuel to produce the neurotransmitters, especially serotonin, in the case of depression. Number 2, there is evidence that if we eat anti-inflammatory diet, we have less inflammation and therefore better mood. Number 3, your mood is linked to the bacteria that lives in your guts. And it takes time to replace the bad bacteria for the good bacteria in your guts. So it is important to stick to a healthy diet for a long time. So here is the recipe. Reduce sugars and increase fruits. Eliminate pops and drink water. Reduce white flour and increase whole wheat flour. Replace white rice with brown rice. Reduce animal fat and increase fat from seeds and nuts. Reduce red meat and increase fish. Reduce bacon and increase olive oil. Eliminate hot dogs and eat more vegetables. Eliminate cookies and eat more beans. And reduce butter and increase yogurt. So these items are included in the anti-inflammatory diet that is good for depression. Your pillow. Sleep problems can lead to depression, and depression can lead to sleep problems. So they go hand in hand, and improving your sleep efficiency will help to reduce the depression symptoms. And one way to improve sleep efficiency is by changing some sleep habits and routines around sleep. We call this sleep hygiene. Having a healthy sleep habits will make a big difference in your mood. And here are some tips. Exposure to bright light, a light box in the morning, and darken your bedroom at night. Eat and drink in moderation before bedtime. Do not get up at night to go to the washroom or to eat. And get tired during the day by doing exercises. Occasionally, you may take a short nap in the afternoon. Have the same bed routine every day. Reduce the noise of your bedroom. Reduce the temperature of your bedroom. And reduce distractions in your bedroom. Also, relax your mind before bedtime. You may also use some natural medicines like melatonin or magnesium to improve sleep. And I have another video about sleep efficiency that you can watch, and I show more details about all of these sleep efficiency recommendations. Physical exercise. When we exercise, our body releases endorphins, that is the feel-good hormones, or our endogenous opioids. Also, when we exercise, we distract our mind with our movements, we are counting the repetitions, we are choosing the equipment, we are preparing the positions, and all of that is good to distract our mind from our worries. The more we exercise, the more we gain confidence and self-esteem. Exercise are also excellent for social interaction, for going outdoors, and meeting people who are interested in a healthy lifestyle. Any exercise will work. Try to do what is more pleasant to you, what you enjoy. I love dancing and I like music and the rhythm. I made a video about dancing for arthritis and you may watch. There are a lot of online classes for dance, yoga, Pilates, stretching, etc. Try to practice every day, even if it's just for 5 minutes. Start slow and increase by 5 minutes every day. You may want to find a partner in the beginning to do these exercises together, so you can get motivated and stick to your plan. Don't push yourself too hard in the beginning. Allow yourself some rest days. And maybe you want to set some goals to start exercising, let's say 1 or 2 days a week for 5 minutes, and then increasing gradually. Maybe you want to say my goal is exercise 5 days a week for 30 minutes each day. You may need to buy some simple equipment such as an elastic band or free weights. Don't spend too much money, but the good thing is if you invest a little bit of your money, you feel more compelled to use the equipment and adhere to your plan of doing exercise regularly. Antidepressant pills. There are a variety of antidepressant medications that can be used. There are different groups of drugs, and within each group, there are various drugs that can be used. So, for example, SSRIs, or selective serotonin reuptake inhibitors. Some examples are fluoxetine or Prozac, paroxetine or Paxil, sertraline or Zoloft, citalopram or Celexa, and escitalopram Lexapro. These medications are usually the first line that we try, and they are very effective for depression. It may take a few weeks until the person notices the first effects in the depressive moods, and they need to be taken every day. The SNRIs are good to treat depressive mood and chronic pain, so I tend to use these medications a lot. Examples are the duloxetine or Cymbalta, venlafaxine, Effexor, and desvenlafaxine, Pristiq. The tricyclic antidepressants are also my favorites. They are excellent for treatment of neuropathic pain and sleep disturbances in people who have fibromyalgia. Examples are amitriptyline or Elavil, nortriptyline or Pamelor, imipramine, tofranil, and desimipramine, norpramine. Then there are other types of antidepressants that are prescribed by psychiatrists for more severe depression or for the treatment of resistant depression. A treatment-resistant depression is a depression that has not improved after a trial of 6 weeks of 2 antidepressants. But it is important to use the therapeutic dose for 6 weeks. I see a lot of people who don't stay in the therapeutic dose for 6 weeks, and then they want to change the antidepressant. You need to talk to a psychiatrist because about 40% of treatment-resistant depression are due to bipolar disorders or other medical conditions. A medical condition that is commonly associated with depression is hypothyroidism. And I have another video about that. You can check here. And sometimes treatment-resistant depression is treated with atypical anti-psychotics like aripiprazole, Abilify, quetiapine or Seroquel, risperidone or Risperdal, and olanzapine or Zyprexa. There are other kinds of antidepressants like trazodone, mirtazapine, vortioxetine, and bupropion. It is important to get a consult with a psychiatrist to make a proper diagnosis of the type of depression and the best antidepressant medication. Although most antidepressants are generally safe, they should be prescribed with caution in people under 25 years of age. They may increase the risk of suicidal thoughts. And the last letter P is for psychological therapy. Psychologists can help the person in a variety of ways. They will use different techniques to help patients to deal with symptoms of sadness, hopelessness, guilt, anger, restlessness, difficulty concentrating, fatigue, sleep problems, appetite changes, chronic pain, loss of interest in activities, withdrawal from friends and family, and thoughts of suicide or death. The counselor may use techniques like cognitive behavior therapy or CBT. This is a psychotherapy that involves learning to identify and then manage those negative thoughts and behavior patterns that can contribute to their depression. The therapist will work with the patient to identify unhelpful or negative thoughts and help them to change inaccurate beliefs and replace them with more positive and realistic thoughts. Mind-body therapy can be delivered in person, by video conference, by telephone, or even by certain electronic methods on computers and on smartphone apps. So in summary, depression is a serious mental health disorder that affects a lot of people with chronic pain. And these 5P strategies can be used in combination to provide a faster method to improve symptoms and restore function. And remember, the plate, pillow, physical, pills, and psychological therapies. Please don't forget that this video is for educational purposes only. If you have a condition that needs medical advice, please talk to your doctor. And if there is an emergency, go to the nearest emergency department. Use the comments below to suggest topics for future videos. And below there is a link to a document that you can download, and it summarizes all the content of this video. If you like this video, don't forget to give a thumbs up, turn on the notifications, and subscribe to this channel. And there is a share button here that you can send this to your friends or people who need to hear this message. I have many other videos on this channel. You can check there to see the other topics. You can also find me on Twitter, Facebook, and Instagram. Thank you for watching. Goodbye!